Are you struggling with hair loss and looking for actual treatments that help? Well, you have come to the right place. My name is Dr. Swati Kannan, and I am a board-certified dermatologist and a hair transplant surgeon here in San Diego. I treat hair loss on a daily basis, and I've helped countless patients grow denser, fuller hair with evidence-based treatments. Today in this video, I'm going to break down the top 10 treatments that actually work for hair loss, and some of these treatments you can do at home, and some of them are the treatments I do in my office. So make sure you stay tuned till the end. For more details on why we get hair loss and what actually influences hair loss, I do have 2 prior videos that you can definitely review if needed. Oh my goodness. This is so cute. We have a guest, Finn. We have a guest. His name is Finn. He is blessed with hair follicles, actually. You're Finn, you good? Oh, yeah. Alright, well, if you want to grow hair like my dog, watch this video. So first, let's talk about what's normal. We have about 100,000 to 150,000 hair follicles on our scalp. We cannot grow more follicles than the ones we are born with. It's normal to lose about 100 to 150 hairs a day. Hair loss is when you start losing more than 300 to 700 hairs a day. So I hope you don't count the number of hairs on your floor, but you can kind of estimate and look at your hairbrush or look and just see how much you're shedding. As we get older, it is completely normal to see a decrease in our hair density. So if you come to me and you're 65 years old and you say you have less hair than when you were 18, well, that is just a normal aging process. And sure, I can do treatments to help you grow more hair, but I can't make it look like when you were 18. For outsiders to notice hair loss, you have to lose about 50% of the total hair for it to be noticeable. So that's quite a bit of hair to lose before it becomes noticeable. The most common form of hair loss is called androgenetic alopecia. And in men, this is referred to as male pattern baldness. And in women, it's referred to as female pattern baldness. When we're discussing treatments in this video, we're mainly going to be focusing on the treatments that help androgenetic alopecia. The reason we get androgenetic alopecia is because of the hormonal influences. So mainly the androgens. So for men, the hormone dihydrotestosterone plays a role with hair loss, and in women, other male androgens play a role with hair loss. So when we're looking at treatment options, we do want to decrease some of these hormonal effects for efficacy. The first treatment for hair loss, and you probably guessed it, it's going to be minoxidil or Rogaine. Minoxidil comes as an oral form and a topical form, and we're going to discuss both. Topically and over the counter, you can find 2% or 5% minoxidil. I always tell my patients to start with the 5% men's version. Nobody needs to use the 2%. I will also sometimes do a prescription topical minoxidil that comes at higher percentages ranging from 6 to 10%. And sometimes these topical minoxidil prescriptions are also combined with other ingredients to help augment the hair growth process. There's not that many side effects from using topical Rogaine, aside from the fact that it's kind of sticky. So people don't like using it on a daily basis, especially if you don't wash your hair on a daily basis. And if it gets on your face or other parts of your body, you will grow hair there unless you wash it off. The way minoxidil works is that it dilates the blood vessels. This then allows more nutrients to be able to go to the hair follicles for hair growth. It also prolongs the growth phase of the hair follicle called the anagen phase. More than this, we actually don't know why topical minoxidil works the way it works. This is just our hypothesis. Fun fact, minoxidil was actually used as a blood pressure medication because it lowers blood pressure. And we found that these patients also grew hair. And that's when it kind of became formulated in its topical version for hair growth. The way you would use minoxidil topically is you would get the 5%, and it comes as a spray, a dropper, or as a foam, and you just kind of part your hair and apply it. I usually suggest doing it once a day, usually at nighttime before you go to bed. You want to wait at least 4 hours after application before you wash your hair. In order to see improvement from topical minoxidil, it takes 6 months or longer. So you have to be incredibly patient. I think if you've been watching some of my videos, you know that nothing is like instantaneous except for maybe Botox and fillers. So everything else takes time to see results, and hair loss is one of those things that takes an exceptionally long time for you to notice results, no matter what treatments we do. And keep in mind that when you first start using Rogaine, you're going to notice shedding, and that's because your hair follicles are trying to get to the anagen phase or the growth phase. But in order to get to the growth phase, they first have to go through the telogen phase, which is the shedding phase. So this usually happens within the first 3 months of using minoxidil. You just have to power through it. And I promise you will go back to the hair growth phase. For all hair loss treatments, including Rogaine, it is something that you will have to use lifelong. I tell my patients that having hair loss is like having diabetes. You will always have to do something to either maintain the hair growth that you have or to grow more hair. So that means that you have to use Rogaine every single day for life. If you stop using Rogaine, then you will go back to your baseline. It's not that you lose more hair than if you never started Rogaine at all, but you just go back to your baseline. I like to also combine topical Rogaine with other ingredients like retinoids or salicylic acid. Retinoids and salicylic acid help with better penetration of the topical minoxidil. And this is especially helpful in patients who could be resistant to minoxidil. So about 20% of patients are resistant. And there was actually a study done back in 2019 where they used topical retinoid for 5 days prior to starting topical minoxidil, and they found that 43% of the patients who were initially non-responders started responding to the Rogaine after using topical retinoids. So it's something that you can definitely use in combination. I don't think, there are a lot of dermatologists who are saying just, use retinoids to your hair, and that might help a little bit, but it really isn't a slam dunk. It's really the combination of the retinoid and minoxidil that is helpful. So in fact, I had hair loss during COVID, and that was actually really common to see hair loss during COVID era back in 2020. And I used prescription Rogaine 7% combined with Spironolactone, and I did this for 9 months. And you can see that my hair part looks a lot less wide in the after photo. So consistency does pay off, especially if you start it in the beginning stages of hair loss. Now, minoxidil also comes as an oral form or in a pill. And there was this New York Times article back in 2022 that I swear to God, for 3 months after publication of this article, I had so many patients asking me about starting oral minoxidil. And I actually think it's a really good treatment. For one, you don't have to mess with topical minoxidil because it's very sticky. Oral minoxidil is just a pill. It's very simple to do and it doesn't mess with your hair care regimen. We use it in lower doses. So like I said before, it's a blood pressure pill, but we're not using it in high doses. I start with a very low dose and I increase as tolerated. The most common side effect from oral minoxidil is something called hypertrichosis. This is when you develop hair on other parts of your body. So like your face, your arms. This tends to happen more in women than in men. And I've noticed that in ethnic women, so melanin-rich women tend to get more hypertrichosis than their non-melanated counterparts. So if you can tolerate extra hair growth, then by all means, oral minoxidil is a really good option. The other side effects include edema, meaning swelling. You can also get orthostatic hypotension. This is when your blood pressure lowers when you stand up from a seated position. It's more common in younger women or in women who have low blood pressure to start with. You can also get some other cardiovascular side effects, and the rarest side effect of minoxidil is called pericardial effusion, and this is where you get fluid around the heart, and that can obviously cause problems. So we do monitor for side effects, and if you have any history of cardiovascular issues, I actually don't start you on oral minoxidil. So that was quite the overview on minoxidil, primarily because it is the first line treatment for hair loss, so that is why I spent so much time on it. The next treatment is something called platelet-rich plasma, or PRP. This is a treatment that I do in my office, and we have studies to show that if we combine PRP plus minoxidil, we have much better hair growth than doing either one alone. PRP utilizes your own blood. So we take your blood, we spin it down, we take the growth factors and inject it into your scalp. It is a series of treatments. I usually tell my patients we need about 4 to 5 treatments spaced a month apart to be able to see results. And what these growth factors do is that they increase blood flow to the hair follicles, but they also act directly on the hair follicles to help make them bigger so that your hair is thicker. Most patients will start seeing hair growth within 3 to 6 months after the first few treatments. The first sign that patients will see with PRP is that they have less hair shedding. So usually by treatment number 2, you will notice your hair is not falling out as much as it used to. And then of course, like all treatments, you do need maintenance with PRP. For some of my patients, that maintenance is every 3 months, especially in the beginning of their hair loss journey, but then it can go up to 6 months or every year. So here is a patient that only did PRP alone. He did not want to use any topical Rogaine, and you can see that after 4 treatments, he has quieted the hair growth. So we can get some pretty amazing results from PRP. However, not all PRP is made equally. So again, you really want to see, board certified dermatologist who focuses on hair, who has the right equipment to have that concentration of platelets, because that concentration of platelets is really what makes a big difference in terms of the growth factors that are being delivered to the scalp. Unfortunately, though, PRP is not covered by insurance, so it is out of pocket. Most hair loss treatments are out of pocket. Your insurance is not going to cover it because they consider it a cosmetic issue, so PRP can become expensive to do. The next treatment for hair loss is topical anti-androgens. So androgen is the name for the male hormones that cause hair loss. And anti-androgen means any treatment that's going to negate the effect of those hormones. So over the counter, you have a shampoo called ketoconazole shampoo. It comes as 1 or 2%, and you can actually use this 3 to 5 times a week to help with hair loss. Ketoconazole is technically an antifungal, and so that means that it helps with yeast buildup in our scalp, which causes dandruff. Dandruff, by the way, can cause hair shedding as well. But ketoconazole also has mild anti-androgenic effects. So it kind of helps you with hair loss in 2 different ways, by decreasing the yeast population and having the anti-androgen effects. You massage the ketoconazole shampoo onto your scalp in the shower. You want to leave it on for about 5 to 10 minutes and then you rinse it off. It does make the hair a little dry and it doesn't really smell very good. So I often will tell patients to use your normal shampoo or conditioner afterwards. For a lot of my female patients, I really like the Vegamour shampoo and conditioner. It has a complex called carmitin, which kind of coats the hair. So it helps to decrease hair breakage and just makes it look more fuller. I don't use ketoconazole shampoo by itself. It is an adjunct. So we, use it in conjunction with minoxidil and PRP. The next treatment for hair loss is low-level laser therapy, LLLT. And it uses red light, the red wavelength rather, because it is technically a laser. So it uses the red wavelength between 630 to 660 nanometers. And the reason it's so specific is because we want the light to penetrate a certain depth for it to be effective for hair growth. What LLLT does is that it increases cellular activity, so basically affects the mitochondria of the cells. This then leads to a cascade of events which then prolongs the growth phase of the hair cycle, so meaning it prolongs the anagen phase. It is a really great non-invasive option. Again, it's used in conjunction with the other treatments I discussed, not by itself. So there are multiple modalities that deliver LLLT, so you can have your hair caps, your helmets, your combs. I usually recommend doing a hair cap or hair helmet that you just kind of put on, and you want to use this about 20 to 30 minutes, 3 to 4 times a week. Improvement does take time. It can take about 3 to 4 months to see results, and consistency is really key. Now, there might be confusion between LED, light emitting diode, and LLLT, which is the laser therapy. LED is not technically a laser, but it's just a red light. When it's used in a hair cap, it kind of disperses the red light more diffusely, but it doesn't really penetrate too deep. However, it is cheaper to make, and so a lot of the cheaper helmets will have more LEDs. LLLT, it is a laser, and it doesn't diffuse, it's very cohesive and it just kind of goes deep into the hair follicle. So LLT is more effective than LED, but it's also much more expensive. A lot of the hair helmets that you can find over the counter tend to combine both LED and LLLT. And the price really ranges from $600 to $2,500 for these devices. And the price also depends on the number of the LED or the laser lights within the cap. The higher the number, the more effective it is, but the pricier it is as well. So my recommendations for hair caps and hair combs, they're in the description below, so go check it out. By the way, if you are enjoying this video and you're finding it helpful, please hit the thumbs up button and don't forget to share it with your friends and family. Also, hit that subscribe button so you can stay tuned with up-to-date videos. The next treatment for hair loss is quite controversial, and it's Finasteride and Dutasteride. So these are medicines which block the conversion of testosterone to the hormone dihydrotestosterone, or DHT. DHT is the reason men and women actually get hair loss. Mainly men. Women have very low amounts of DHT. DHT is what shrinks the hair follicles in male pattern baldness. So this particular medication helps to halt hair loss. Usually, again, it takes several months to see results, and it is something that you have to take lifelong. I don't use Finasteride or Dutasteride for women of childbearing age because it can affect the fetus. I also, in general, don't really give it to women because I like to use a different medication for female pattern hair loss that I will talk about next. Between Finasteride and Dutasteride, which one is better? Recent studies actually show that Dutasteride is more effective than Finasteride for hair loss, but they both come with side effects, and the main side effect, which is why this medicine is so controversial, is the risk of sexual dysfunction. And this risk with Finasteride and Dutasteride varies from like 1% to 15%. And the sexual side effects mainly include erectile dysfunction, ejaculatory dysfunction, and decreased libido. For most patients, if they do get the side effects, once they stop the medicine, they go back to normal. We now know that there is a percentage of patients who have permanent sexual dysfunction, and we don't really know why they have that. So if you're interested in Finasteride, also called Propecia, then it's a discussion that you need to have with your dermatologist and primary care doctor. If I start Finasteride, again, I start at a pretty low dose, and I only go up if I need to. So usually at these low doses, most patients do well. For women, the hair loss medication that I like to use is Spironolactone, which is an anti-androgenic medication. So Spironolactone blocks the effects of male hormones on hair follicles, which is the primary reason for female pattern baldness. I also like Spironolactone because it helps with hormonal acne. So that's the acne that women can get along their jawline and their chin. I usually start with about 50 milligrams a day. I make sure that you don't have any side effects, and then I titrate your dose as tolerated. For hair loss, we do need higher doses of Spironolactone at about 200 milligrams a day for it to really be effective. And again, it takes a long time to see results, and you have to use it lifelong. The main risks of Spironolactone include electrolyte imbalances. So Spironolactone is what we call a potassium-sparing diuretic, meaning that it increases potassium levels in the blood. You know, when I was doing residency about 10 years ago, we would draw potassium levels for women prior to starting Spironolactone, but then newer studies in the past 5 years have told us that we don't actually have to do that, that for women who are young and who have normal kidney function, they will regulate their potassium just fine, even on Spironolactone. So we no longer check potassium levels unless I have a reason to do so. The other side effects of Spironolactone include breast tenderness, which usually goes away with time, even on the medication, menstrual irregularities or spotting, and this usually can be treated if the patient's also on birth control pills. And the other side effect of Spironolactone is lowering of blood pressure. So technically, Spironolactone is a blood pressure medicine. We have a theme, right? Like we're using these blood pressure medicines for hair loss, but it's technically a blood pressure medicine. And so for patients who already have low blood pressure, you could get orthostatic hypotension, like I mentioned before. You get some dizziness, and you will also pee more because it's a diuretic. I don't really give Spironolactone to men because it can enlarge their boobs, called gynecomastia, and I don't give it to women of childbearing age because it can affect the unborn, the fetus development. A lot of my patients, especially in California, by the way, they don't always want to jump to oral medicine. So lately what I've been doing is I combine the topical minoxidil with retinoid or salicylic acid to help penetration, and with either Spironolactone topically for women or with Finasteride for men. And I found that this triple combination therapy is just very helpful for hair loss without the systemic side effects that come with oral medications. The next treatment for hair loss is microneedling. So microneedling by itself doesn't really, it's not like going to move the needle with your hair loss, but when it's combined with other treatments, it can be actually pretty helpful. When we discuss microneedling for the scalp, I do not recommend a derma roller. So a derma roller, you just kind of roll it on the scalp, but what this can do is that it can kind of cause these linear erosions along your scalp, which can sometimes cause inflammation and scarring and further your hair loss. So I don't like the derma rollers, but I do like microneedling pens, which are stamping devices where you just kind of stamp the microneedle and you're not rolling anything. There have been a few studies that found that when we combine microneedling plus PRP or microneedling plus topical minoxidil, that the hair growth is more compared to either one alone. So in my office, if I'm going to combine it with microneedling, I'm going to use higher depths to be able to allow the PRP to penetrate deeper. This also means it's more painful. But if you're going to be using microneedling at home, your needle length should be 0.25 to 5 millimeters in length. You should not go higher than 0.5, and that is because there is a risk of scarring if you do it improperly, which can scar the hair follicle and thus potentiate hair loss. So you can use a device like this at home. It is pricier than a derma roller, but it's safer. And honestly, if you don't want to risk it, just go see a dermatologist. If you're going to do it at home, then I would recommend doing it about 2-3 times a week, and usually at nighttime and you don't have to do it for 20 or 30 minutes. You're just gonna kind of stamp it along your hair and then use your topical minoxidil on top and go to bed. If you cannot obtain one of those stamping microneedling devices, then you can actually massage your scalp. We know that massaging increases blood flow to the area, so you can get one of these little contraptions and kind of just massage your scalp, which also feels really good. You want to do this for about 20 to 30 minutes, 3 to 4 times a week, and then apply your topical medications. You can even massage with oils, and that is the next treatment I'm going to discuss, is using certain oils for hair loss. By this point, you have probably heard about using rosemary oil for hair loss. The study that made this popular is the rosemary oil was compared to 2% minoxidil and found that it was equally as effective as 2% minoxidil. I will be honest, I have never in my life as a dermatologist used 2% minoxidil. Every single patient I know, I made them start 5%. So because we know that the 5% is just way more effective than 2%. So 5% minoxidil, which is the treatment of choice, is more effective than rosemary oil. However, there's very little downside to using rosemary oil. So that's why if you want to use it, I'm all for it. The way you use rosemary oil is you take a few drops and you want to mix it with a carrier oil like jojoba oil or coconut oil, and then you kind of massage it onto your scalp. You want to leave it on either overnight, but at least for 30 minutes before you rinse it off. And you want to do it about 3 to 4 times a week. Other oils that are helpful include cedarwood oil. Cedarwood oil actually also controls the yeast population on your scalp, so it helps with dandruff as well. And thyme oil. So thyme oil, again, affects the hair follicle similarly to rosemary oil. All of these oils, by the way, you don't want to apply them directly onto the scalp. You do want to use them in a carrier oil. By the way, have you tried these natural treatments in the past for hair loss? Please comment and let me know below. Let me know what worked and what didn't, because I'm really genuinely curious to see all the different options that people try. The next treatment for hair loss is using supplements or vitamins. So the main ingredients that I like to use for hair growth include vitamin D, vitamin B complex, iron if you're iron deficient, zinc, selenium sometimes, ashwagandha, which is an Ayurvedic herb, and omega fatty acids. And these are the top most ingredients that have higher evidence for them when it comes to hair loss. You're probably wondering, why didn't I include biotin in that list? And that is because biotin, it's a great myth that it helps for hair loss. And it is, unfortunately, in a lot of hair vitamins and supplements. In lower doses, biotin can be helpful because it is part of the B complex. But at higher doses, biotin can be pretty harmful because one, it can cause acne. In some patients, it can worsen the alopecia. And in other patients, it can cause something called glossitis, which is like inflammation of the tongue, as well as a few other rashes. So I don't recommend overdosing yourself with biotin. Some of the hair supplements also contain an ingredient called saw palmetto, which is an herb. And saw palmetto works similarly to Propecia or Finasteride in the sense that it blocks the effects of DHT, but it has much milder side effects than Finasteride. It's also less effective than Finasteride, but it is something that you can try. The main problem with saw palmetto is that it can interfere with other medications that you're taking. So you do want to run this by your primary care doctor before you start it. If you want to take saw palmetto and after it's been approved by your primary care doctor, the dosing is about 200 to 320 milligrams daily, and it takes 12 months before you see results. The other supplements for hair loss include Nutrafol, Viviscal. These are 2 supplements that have really dominated the hair supplement industry, and I think Viviscal is cheaper than Nutrafol, so you can try either one. They are expensive, they require a lot more tablets. So for most of my patients, I just recommend taking a multivitamin and then supplementing that with ashwagandha and omega fatty acids so that you can have all of the vitamins needed for hair growth. The next treatment for hair loss is actually a hair transplant. So for some patients, that is what we have to jump to if we want maximal hair growth. And for others, it's kind of the final step once they've tried all these other treatments that I've just discussed. There's been a lot of hype about getting hair transplants in Turkey or in Mexico because it's so much cheaper than getting it in the US, but there's also a lot of problems associated with getting your hair transplants abroad. You know, I tend to see these hair transplants in my office because they want a correction, or sometimes they're just so fed up with how bad the transplant looks, they just want me to laser all of their hair off and they want to go bald, which is very extreme. However, there's a lot of problems associated with doing hair transplants abroad. So if you are curious about hair transplant and you want to learn more and you want to know what makes a hair transplant look natural versus what makes it look bad, I want you to check out this video next where I go in depth into hair transplants. So thank you for watching this video and I will see you in the next one.